So again, fat recommendations have changed quite a bit because we know more, not because we just keep changing our minds for the heck of it. So with dietary fat, with our DRIs, our dietary intake, we have a recommendation of 20 to 35% of total calories. So it used to be 30% in the dietary guidelines. Now there's not one so much on total fat. But that is with our dietary reference intake values from the Institute of Medicine is an acceptable range, okay, between 20 and 35%. And why is that? Why don't we go higher? Because with a high fat intake, we have a lot more calories, and saturated fat usually goes with it. So those are the two things we're concerned about. Low fat intake, if we go down to the real extremes below 20, we start having higher intake of carbohydrates, which can have some of its own issues, especially if they're simple carbohydrates. So again, is what we need to worry about are when people do extremes of any of this. So nutrition science has moved beyond total fat, like I've said, and where we look at the role of specific fatty acids. So we talk about saturated fatty acids, monounsaturated fatty acids, polyunsaturated fatty acids, which can be broken down into omega-3s, 6s, and then the trans fatty acids, which basically the recommendation is have as little as possible. But with omega-3s, a lot of that has led to the seafood and fish recommendations we'll talk about. But the omega part just has to do with where the first double bond is in the fatty acid, if you can remember back. Wow. The structure's sort of there. So with the dietary fats, I'm going to go through so I see what's all there. We have a chain length, whether it's saturated or polyunsaturated, that's going to range from 4 to 24. You can even go higher once we start making them in our bodies. We have saturated or not, and if it's unsaturated, how many double bonds there are. So the position of unsaturation on the right side, sorry Ray, on the right side over here you have what's called the acid end or the carboxyl end, and on the left side, you can't see, are the omega-3 end, or a carbon and 3 hydrogens. And it's really where that first double bond starts that gives it its name. That's really all that one needs to know with that. But they act differently in the body, and they make different things because of those simple differences. So if you take a look at foods, for example, it's not like a food is all one type of fatty acid. It's going to be a mixture, and you look at what the majority is. So I'm not going to read through all of these, but you can see with the solid fats, you're going to have more saturated fats in there. And everybody's favorite these days, on the top there is coconut oil. And I know we have a question, and I'll talk about it, because I like getting into arguments at the supermarket with people. Which actually I've stopped now, but I used to do a lot. And so there's a high amount of saturated fat in the coconut oil, for example. But it's not just whether it's saturated or unsaturated. You've got to keep in mind it's the length also that will determine how we metabolize it in our body. Then there's the oils, and you see a variety. So quite often there's questions about where can we get more of our monounsaturated fatty acids. You can see that's like the middle orange one, and you can see that that's in avocado oil, sunflower oil, and so forth. So if you're not already familiar with this, now you have it on your notes there. So there's important aspects to all of these. With monounsaturated fats, they work not primarily, but quite significantly in our nervous tissue. So they're very important for a part of the membranes. For polyunsaturated fats, we have 2 fats which are considered essential. There's linoleic. That means it's 18 carbons long. There's 2 double bonds, and the first one happens at the 6th carbon from the omega end. So it's an omega-6. It's needed for normal skin. It's a precursor of what shows up there, AA, that's arachidonic acid. And it regulates, just for one thing, how our genes work. So when we're talking about those epigenetic factors, for example, that has some kind of role there, just as an example. It has a whole host of other roles as well. Okay, so that's linoleic. This drives students, like in my general nutrition class, wacko. Because this is linoleic, and then there's linolenic. Linolenic is also an essential fatty acid. When I was a student, it was not considered essential. It's 18 carbons long. There's 3 double bonds. First one's at the omega-3 end. It has a lot of structural roles. A lot of it's in the eye and nerve tissue. And importantly, it's a precursor for what's called eicosapentaenoic acid, which is EPA, and docosahexaenoic acid, which is DHA. So that's EPA, DHA, and those are these long chain omega-3 fatty acids. They're also precursors, so they go to synthesize other compounds called eicosanoids, and they regulate a whole host of cellular functions. A lot of these have a lot to do with inflammation. Trans fatty acids found naturally in some foods, very low amounts, but it's also found through a process called hydrogenation, which Rachel will just touch upon later. But it's used in preparation of commercial foods, taste, stability. They've, since the past few years, removed it from the food supply quite a bit, and so we're not concerned about intake as much because it's much lower than it used to be. It's still a concern if people are going to go to these foods. And it's because of their role in cardiovascular disease. Now, when I was giving these talks 20 years ago, when the trans fatty acid issue was just coming up, I was like, there's no evidence to support that it is a risk factor for cardiovascular disease. So things change. So I'm a little more open-minded, not a lot, a little more open-minded than I used to be. So this is just for your enjoyment, but I like it, so I'm putting it up there because I think it's really interesting with inflammation. And this is just showing you sort of a flow scheme. On your left are omega-3s, and on your right's omega-6. And they both are going to make these longer chain fatty acids. So on your right, that omega-6 is going to make arachidonic acid, which is the AA we talked about before. And on the left, we have linolenic going to EPA. It can also go on to DHA, but it makes these other compounds. Some of them are anti-inflammatory, some of them are pro-inflammatory. And it's the balance of those that are so important for our health maintenance and also a disease-type state. So inflammation is related to everything, and so these omega-3s and the balance is what can contribute to the inflammatory state. So it's important that our body responds through inflammation. It's the way our immune system functions to kill bacteria, for example. But we have to have it moderated, and we have to have it modulated through different types of defenses. But excessive inflammation can lead to a variety of neurodegenerative diseases, asthma, arthritis, which is an inflammatory condition, some cancers, diabetes, cardiovascular disease, whole host of autoimmune diseases. Okay, so that inflammation becomes this common sort of part to the equation. Now, obesity, we've often wondered, how does that contribute, for example, to obesity and types of cancers? And one way is through this inflammatory process. Even with autoimmune disease, now what they're finding is that one that is obese has a higher inflammatory state, and they might be more prone to a variety of types of autoimmune diseases. So because of that and the role of omega-3s in inflammation, there's a lot of attention now looking at omega-3s. There's been studies of the benefits of omega-3 fatty acids, sometimes in supplements, also just in improving one's diet through increasing consumption, for example, of fish. But a decreased risk of arrhythmia, reduced triglyceride levels in some, reduced growth of plaques, and reductions in blood pressure. So with fat, it's still highly debatable in terms of total and saturated fat, in terms of what we should have. For years it was eat less fat, reduce LDL cholesterol, and then we have the highly refined carbohydrates. That can be more of a problem. And still, if you were to Google or Google Scholar through a lot of the papers on this, you're still going to come across all this debate. But the agreement basically is limit saturated fatty acids to 10% of calories, replace saturated fatty acids with polyunsaturated fatty acids. Total fat intake is not as important as the type of fats. And MUFAs, or monounsaturated fatty acids, they lower LDL and improve the cholesterol ratio, but not as much as PUFAs. So again, it doesn't mean all or nothing, and it doesn't mean people need to cut out saturated fat completely from their diet. It's to reduce it. And then omega-3s, eating omega-3 fatty acids, preferably in your diet, meaning that's the eating, twice a week. With the other information about dietary fat and the dietary guidelines is with saturated fatty acids, if one wants to reduce it to 7% of total intake, that might still reduce one's risk for cardiovascular disease. Again, this is going to be highly variable for all the reasons we've talked about. Trans fat as low as possible. Cholesterol, now in the 2015 dietary guidelines, there's no restriction. Now, when that came out in the press, everyone's saying, oh, it's the meat industry or it's the dairy industry. It was not the industry. It was that there for years, there was not a really strong relationship between dietary cholesterol and serum cholesterol. The relationship is with saturated fat and serum cholesterol. So with dietary cholesterol, it doesn't mean that somebody should go have 7 eggs a day. Because of course that is what happens when people read it. So we have to be aware of that. But there's no restriction on the cholesterol now. But if you're restricting saturated fat, you're automatically going to be reducing dietary cholesterol. With seafood. So remember how I said they graded the evidence in this evidence-based type of journey? And so the moderate evidence is what they came up with for the seafood intake. So that's pretty good. It's not the best, but as far as the studies are going now, we'll stick with the moderate evidence. So 8 or more ounces a week, so that's really about 2 servings a week. And that should be equivalent to about 250 milligrams of DHA and EPA, and that's may lower cardiac deaths. So the type of foods that you find this in, salmon's a great source. Anchovies, herring, all the ones listed up here, trout. But then comes the problem with mercury. And so I know, for example, that at some nutrition education sessions in different health plans or in different hospitals, the RDs have been counseling, at least a couple years ago, against women consuming tuna. And it's not as if all tuna is contaminated with mercury. Tuna, light tuna, is a fantastic source of protein, and it's also a relatively cheap source of protein. So it can be very beneficial if had not going above the 2 servings a week, or even 1 serving a week. So there's moderate evidence that DHA in seafood will improve infant outcomes. And you can, again, what's recommended is between 8 and 12. Those 12 ounces should not be only of tuna, should be from a variety of seafoods. And you want to opt for fish low in methyl mercury. So some of those fish are shown up here, and they're the same ones that, just with little pictures, that I had in the other slide. So with mercury and fish consumption, there are high risk groups. There are pregnant women, women of childbearing age, so yeah, that's between 12 and what, 50? Nursing mothers and young children. So that's a concern with the mercury, and I'll talk a little bit about the ones that are at highest concentration. Shark, swordfish, king mackerel, and tilefish. I used to just list these. These folks made these gorgeous slides. Thank you. But you can still, you'll go to to markets and they're still selling shark and swordfish. So again, it's about eating very small amounts of that, especially if you're in the high risk group. If you're an adult male, go for it. Doesn't mean you need to have constant high amounts, because you matter too. But you're not gonna have babies and so forth. So it hasn't been shown to have huge effects on men. But in high amounts, there might be effects in terms of brain function, cognitive decline, and so forth. American Heart Association recommendations are actually consistent with our dietary guidelines. For healthy adults, and they have specific recommendations for omega-3s. Again, eat a variety of fish about twice a week. Include oils and foods that are rich in alpha-linolenic acid. So that's flaxseed, canola, soybean oils, and walnuts. So what this means, quite often you'll hear that we cannot make those EPA and DHA, those long chain. We can, but very, very limited. So you can get some from eating the linolenic precursor, and then your body will make some, but in low amounts. Okay, so it might be beneficial for somebody who is not going to eat fish to have a supplement. But you don't want to go crazy. You don't want to take too high of a supplement either. You want to stick around that 250 milligram. This is just so you had a reference that you can go back to if you want, but this talks about fish oil supplementation and cardiovascular disease. And what is also with the American Heart Association is if somebody does have documented heart disease, to eat about 1 gram, so a little bit more of the EPA and DHA, again, preferably from your food, from fatty fish, salmon, for example. Capsule form's okay, but you need to talk to a physician about that, and they might not know, but you need to question that, because if you take too high of a supplement, one of the things that does is it thins your blood a little bit. And if you are a patient that is a heart patient, you're already on blood thinners. You also might be popping the vitamin E because you heard that was good. So here, and some aspirin. So they're all doing this. They're all thinning your blood. And again, people will think, at least now the health profession is starting to ask, when they ask about medicines patients take, they're also asking about supplements. But for years they weren't. And so vitamin E, as I said, aspirin, they're going to work similarly where they're going to thin your blood. So you take that along with a bunch of fish oil capsules. You just need to have that blood thinning mechanism monitored, which you can do with clotting time. If you are taking supplements, you want to see a doctor if you're going to take more than 3 grams. I don't advise it, but it sometimes might be advised under the care of a physician if you are a heart patient. The hazards of taking too much, impaired immune system, mixed results on that, but there's been some concerns raised. But bleeding and stroke, also mixed results, but at high levels. Again, you have people thinking a supplement is safe because it's not medicine, and they might take quite a bit because they really want to prevent that heart attack. And they're taking the aspirin, they're taking vitamin E, and so it's a concern. With the oxidative damage, I'll just address that because you'd see it if you're looking in the literature. These omega-3s are polyunsaturated fatty acids. They're very susceptible to free radical damage. And so if you're taking too much of them and you're not taking enough vitamin E, your body's not protected against free radical damage. So the studies, when they're looking at this, they're trying to balance the vitamin E intake with the polyunsaturated fatty acids. So that's why that pops up if you were to look in the literature. There's no upper limits now set for fatty acids, although you need to be aware of these concerns, meaning there's no DRI upper limit set. Coconut oil. How many of you have heard of coconut oil? So it's receiving, quite a bit of attention. I mean, there's whole aisles in the store of just coconut products. And so it started with some studies looking at people that had a high amount of their oil was coming in from coconut oil. And so there's, as a result of that, it's been sold as a cure-all for, it's going to improve Alzheimer's disease outcomes. Now really, if it did that, wouldn't we be bottling it somewhere and really selling it as a medicine? It provides peak performance energy. By the way, there's no evidence at all. It helps with hypothyroidism. Nope. It kills bacteria and viruses. Nope. It promotes weight loss. Are you kidding? This is a fat. And those people are in excellent health. Well, they have a whole variety of other factors that are different in their diet and their lifestyle as well, and it hasn't been really repeated. But with the coconut oil, I have searched, and all the time, every time I'm trying to update, and I teach a class where this is included also, so I really do scour the literature, really hoping to find something of value, which I don't. But it's really inconclusive. These contain medium chain fatty acids. Okay, so they're saturated fats, but they're smaller than some of the other ones we see in meats, for example. And so it might not be as detrimental as the saturated fat that we find in other foods. But it doesn't mean that it is completely healthy to have as much as you want. So what the recommendation is, again, is to limit all saturated fats. If one wants to choose coconut oil over another type of saturated fat, then that's fine, but you still want to stay below the 10% of your total calories. So what we need to worry about with consumers is, oh, coconut oil is good, I'm going to add it to everything, as opposed to I'm going to replace perhaps the lard that I'm cooking with or something else, I'm going to replace it with a coconut oil. So all in all, with the fats, there is some agreement to replace saturated fatty acids with PUFAs or polyunsaturated. Also agreement, it's a type of fat, not total fat, that matters. The monounsaturated fatty acids reduce LDL and cholesterol ratio, but a little less than the polyunsaturated, and have omega-3s about twice a week. Keep trans fat to, you guys did a nice job on this slide too. Keep trans fat to a minimum. We're doing that in this country now. And I think you'll talk just briefly about it. Use of food-based dietary guidelines to help consumers make choices and encourage calorie balance and healthful fats. So let me just look at some of these questions on here. So aren't fats bad? So I hope I answered that. Some fats are good, too much of saturated fats not so good. Is coconut oil the best oil for me to eat? Again, that has to do with balance, so I hope I answered that. Can fats be part of a healthy diet? Yes, I've talked about that, and if so, what are some sources of healthy fats? I've talked about fish, and I gave you that list of the different types of oils. And that, I think this says limit all fat. We're talking now really about 20 to 35% of our total calories from fat, and then break it up by the types we've talked about. So I think with that, we're going to take questions now on this, other than what I've just said. Yeah?
I have one. Isn't it the canned tuna, the albacore tuna is higher than mercury than the chocolate tuna?
Yeah, so, and it's not in, obviously it's not in all cans, but when they've looked at batches, they found, studies showed some higher amounts in some of the albacore. Ethically, I have a really hard time with it because of the concern when they're catching albacore, they're also catching dolphins, and so I'm always afraid of encouraging that as well. So the light tuna, it's the light tuna that they're catching the dolphins with, so I've always promoted the albacore. So now, supposedly they've stopped some of those fishing methods, but I wouldn't have like several cans a week of either. But having some is better, you know, than not having it all, because it's such a good source of protein. Yeah.
I get this question all the time when WIC switched over to 1% or 2% milk, and people talking about the process of taking out fat out of milk, and you'll see some like extreme nutritionists that just feel like the recommendation should be that people should be drinking higher fat milk. What is your take on that?
Rachel's going to talk about that.
Okay.
No, she's not going to talk about that.
Fat, sorry.
Here you go. Okay. Well, I mean, I have concerns about it going down to 0% and low fat as well, to be honest, because we can't just only cater to those that are overweight and obese, and we have a lot of kids that need that nutrition. And if you know, I mean, I don't know if we need to go to 0% non-fat, but somewhere a little bit higher than that might be beneficial. Nutritionally wise, there's been a lot of studies that have shown that you don't need to go down to such low amounts to benefit the growth of our kids. I get it, those are big arguments, because then we can get into the whole chocolate milk thing too, which is a real blast.
You mentioned about mercury and cognitive decline. I read the other day that they think it is definitely contributing to dementia. Have you seen any more evidence about that?
I saw some study about 6 months ago, I think, so it's probably recently out in the press, and so there's a possibility of that, but it might also be in the very high amounts of mercury that's consumed, so it depends on where it might be in a polluted area, or people that are fishing out of one area that is highly polluted with mercury. So we used to work with Department of Health Services with their branch that worked on prevention and mercury, and there were a lot of signs up at various fishing areas of when there's contamination and when there's not. So I think, when you're looking at those studies, one has to look at where that food's coming from, and it really is a reason to really promote the variety of fish. We're always promoting a variety of food, but a variety of fish from different sources is really important as well to minimize it.
I'm getting questions about possible radiation poisoning in fish sources
Yeah.
from the ocean.
Yeah, so my husband's a director of the Bodega Marine Lab. And it's funny you bring it up because we were giving somebody a tour last week and they were asking that question. And they've got some kind of, I should pay attention more when he's talking, but, and now that's on video. But anyways, he was talking that they have got these monitors out there and they are not picking significant increases from the recent concerns. And so, see, I did listen to him. So yeah, they have this whole monitoring system though. That's pretty cool up there. Yeah, yeah, that's when they started to that.
Kind of go into making sure we're watching where the fish is coming from too, because if we're getting it from out of the country, maybe there's more.
Yeah, supposedly they're tested, when they're coming in, but here it's. I like to have the locally sourced fish, obviously, but you can't always do that.
Right.
Yeah, so, and farm fish are good too.
Okay.
So that's a whole other issue. Yeah.
So just thinking about our target population,
Uh-huh.
we work with, a lot of them can't afford fish or don't really like fish, so are there other alternatives to?
So it's the best source. So the tuna, like I said, is a cheaper source, but not everybody wants to eat it. And so then some of the oils that have the linolenic acid that were shown up there, flax, walnuts, walnut oil, seeds like that, and then walnuts and flaxseed are good sources. You can also get a supplement of algae that will have it in there too, because you can have vegans that might be a little bit low in it. And so that will have omega-3s in it as well. There and then there.
What about the eggs with omega-3? Is that a significant amount? Or is
It'll add to it. It's not like having fish, but it'll give you some. I haven't tasted them. I know that they taste the same, right? So those would be another good source.
I've heard mixed reviews about flaxseed and that when it's in the full seed form, that's kind of hard to get the.
Yeah, you're supposed to grind it.
So.
Yeah, it is better to grind it.
Okay.
In your spare time.
Yeah.
You can buy it.
I know. Just more money, I think, isn't it?
Yeah, and there's not yet really for our clientele.
Just thinking about your clientele, yeah.
Yeah, if they like tuna, they're good.
The tuna, right.
They have good source of walnuts.
Well, I was just going to say walnuts, right?
Well, and they're expensive too, but some of them don't. But otherwise, it's difficult.
Yeah. Any other questions? Because then I think we're going to take a break. Break? I looked at Mike. Okay, well, thank you. I'm done.
Okay, so we're just going to move on and finish up with fat by talking a little bit about trans fat, like a little bit more about trans fat, and also talking about some other types of fat. So there's, the great debate between butter versus margarine. I remember as a kid growing up that margarine was considered the best thing for us to consume, and then sort of over time it went away from that. So according to this is Medline, the governmental agencies that provide this information, the best option for healthier cooking is to use either olive or canola oil. So those are going to be oils that are higher in monounsaturated and polyunsaturated fats. And that's instead of butter or margarine. So thinking always about trying to switch the solid fats into a liquid form first. Then sort of if you don't do that or don't like that, then the next best option would be to try to choose like a light margarine that the first ingredient is water. So what comes to mind for me is something like maybe Smart Balance would be one of those. Then next would be to choose, so this is in, decreasing best order, right? Next would be then to choose a soft margarine, so that would be tub or liquid versus the stick. Do they still sell stick margarine? I feel like I never see it anymore. Okay, well, don't, and that's the worst, right? So that's the least best option. And if you're going to choose these types of, I can't use the pointer. If you're going to choose these types of margarines, you want it to be with like vegetable oil or olive oil as the first ingredient if it's not water. And so this is just from this website. This is literally what is being told from our government. So if you have high cholesterol, and this is, again, always all these things are in consultation with a physician, but if you have high cholesterol and maybe you're not also taking an omega-3 supplement and vitamin E and aspirin and, right, all those things, but you can think about eating margarines that are made from plant sterols, which are plant compounds that sort of look similar to, they're the same sort of family as cholesterol or stanols. And those would be things that are made from like soybean and pine tree oils. Again, what comes to mind for me is Smart Balance is usually like I think a soybean margarine that's high in omega-3 fatty acids. And that there's some evidence to suggest it can help lower LDL cholesterol. This is not like a general recommendation for everybody that's considered safe, so it's not recommended for children, pregnant women, and people with normal cholesterol levels. So feel free to use just the regular cooking oil that we just said on the first slide. So just very briefly, Sheri introduced the concept of trans fats. The recommendation is to consume as little as possible. I've seen also a recommendation that stated 2 grams or less per day, but it's as little as possible. Hydrogenation is a process that creates these trans fats. So vegetable oils, which are liquid at room temperature, undergo this process of hydrogenation. It's basically heated up in a huge metal vat. And that process adds hydrogens to the double bonds, therefore undoing the double bonds and making it saturated. So that's, and when we do that, sometimes we end up with these trans fats, which are still have a double bond, but it twists the angle, and so then they act like saturated fats a little bit more in your body. In 2013, the FDA decided that we no longer consider these generally recognized as safe because we found that there is evidence to suggest it is raising LDL cholesterol and unhealthy for us to consume. So because of that, in 2015, the FDA told food suppliers that they have 3 years to get trans fat out of the food supply. But there's a little asterisk or caveat to that in that food labels, and maybe some of you have snacks in front of you and you can look, so they should have trans fat listed on the label. It can say 0 grams of trans fat on the food label if it is less than ½ a gram. So for example, Cheez-Its, right? And I hate to throw Cheez-Its under the bus because obviously they're like one of my favorite foods and they're delicious. But Cheez-Its have, I don't know if they still do, but they used to have hydrogenated or partially hydrogenated oils in the ingredients list. But it would say 0 grams of trans fat. So maybe they have 0.4 grams of trans fat per serving. Okay. And they might not. This is just all hypothetical. Let's say, I mean, let me ask the question this way. If you buy a big family-sized box of Cheez-Its, are you eating 1 serving of those while you're watching TV? No, of course not. You're eating 3/4 of the box if you're me. So now we're talking about I've eaten 12 servings of Cheez-Its that may have 0.4 of a gram of trans fat. So when you do the math, that's almost 5 grams of trans fat, theoretically. So that's why we have to be really careful. So the food supply is going to be very, very, very low in trans fat, but it may not be completely gone. And the way that we can sort of suss this out is by reading the ingredients list. So still looking for, are there hydrogenated oils in the ingredients list? Are there partially hydrogenated oils in the ingredients list? So now, lard. It was really interesting. So, you know, we asked sort of for topics to participate, you know, for you guys, you know, to do these presentations. And I was like, lard? Are people talking about lard? And apparently they are, so that's news to me, and I'm really glad. There aren't very many studies about lard at all. There's, you know, we would say lard is a primarily saturated fat. It's an animal source. We assume it results in poor health outcomes because of it being high in saturated fat. There is no scientific evidence to support the consumption of lard. But if you Google, like, should I eat lard or lard and health benefits, a lot of stuff comes up. So the internet thinks lard is really good. This is an ad that I'm assuming is pretty old, but I feel like it's sort of coming back around, this concept that because lard is an animal fat and a natural fat, that it's better. So this is just like, I Googled, like, basically, I think, should I eat lard or is lard good for me, or, you know, something to that effect. By the way, if, you know, you get a lot of questions from your participants, what I'm finding now is a really valuable way to sort of come up with these answers is to Google sort of like these questions, like should I eat lard? And then you see what people are seeing, and it gives me, at least for me, a good sense of where to start. So this is from 2012, and it was an NPR story about that, you know, lard is great, but then as they sort of talked about it, it was saying, well, actually, you know, lard may be okay if you were substituting for a different saturated fat, but still not recommended. So. But look at how many things, oh, this was my favorite one. There's a lot of things, and I just chose a few. This here is a comparison between butter, margarine, and lard. And if you look at the very bottom, I'll draw your attention to that. It calls butter healthy. Margarine is healthier if the trans fat is removed. And then healthiest is lard because it doesn't have trans fat and it's only 40% saturated fat. So again, this is something to consider. Maybe in the grand scheme of things, lard is it's not the worst, right? But we still don't really want to be using solid fats as often as possible. So if that comes up in conversation, that's probably about how I would sort of handle that. Okay, and I think we sort of, because Sheri, we split our slides in a funny place, but if there are any questions about what I've just covered so far. Yeah?
So with the butter topic, or, you know, margarine, salted versus unsalted, if anyone has a question about that part of it, regarding, you know, updates with sodium and everything, what should we say?
So I would kind of just stay in the theme of what Sheri was saying, that overall we want to monitor our sodium intake. We want it to aim to be right around that 2,300 milligram mark. Sodium hides out in all kinds of processed foods and foods that we get out at restaurants and things like that, so it's just something to be mindful of. But in terms of the overall health benefits, I think that's a taste preference while you're monitoring your general sodium intake.